Assalamu alaikum. I am Dr. Sharmin Rahman, Associate Professor, Department of Anatomy, Newszonebd Medical College, Maghbazar, Dhaka. Today we are going to discuss about the cranial cavity, actually the interior of the cranial cavity with its contents. Before going to cranial cavity, we have to know what is skull. Skull is the skeleton of the head and this is known as the skull. Now cranium. Portion of the skull without the mandible is known as cranium. This is known as cranium without the mandible. And now the cranial cavity. The space enclosed by the bones of the cranium is known as the cranial cavity. This is the cranial cavity. Now we have to know what are the contents of the cranial cavity. In the cranial cavity, there are brain, meninges, proximal portion of the cranial nerves, then blood vessels and cranial venous sinuses are present. Now interior of the cranial cavity. The interior of the cranial cavity are divided into three parts. These are known as anterior cranial fossa, middle cranial fossa and posterior cranial fossa. In this figure, we can see this is anterior cranial fossa, this is middle cranial fossa and this is posterior cranial fossa. Now, let's go about the boundaries and contents of these cranial fossas. First of all, boundary of the anterior cranial fossa. Anteriorly, it is bounded by inner surface of the frontal bone and posteriorly, it is bounded by posterior margin of the lesser wing of sphenoid bone. And floor is formed by orbital plate of frontal bone laterally and cristagalli and cribriform plate of ethmoid bone, the lesser wings of sphenoid bone, the jugum sphenoidally and chiasmatic sulcus of sphenoid bone medially. This is anterior cranial fossa. In the bones, we can see this is the inner surface of the frontal bone which forms the anterior boundary. This is the posterior margin of lesser wing of the sphenoid bone which forms the posterior boundary, and floor is formed by the orbital plate of frontal bone which are present laterally, and in medially there are presence of cristagalli, cribriform plate of ethmoid bone, then jugum sphenoidally and sulcus chiasmaticus of the sphenoid bone medially. Now the contents of the anterior cranial fossa. There are presence of frontal lobe of the cerebral hemisphere with meninges on each side, then olfactory bulb and tract, anterior and posterior ethmoidal vessels and olfactory nerves that are passing through the cribriform plate of ethmoid bone. Now, what are the foramens present in this cranial fossa? First of all, foramen cecum. This is foramen cecum which passes an emissary veins from the nasal cavity to the superior sagittal sinus. and cribriform plate of ethmoid bone which passes the olfactory nerves. In this figure, we can see this is foramen cecum and these are the cribriform plate of ethmoid bone. Now, boundaries of the middle cranial fossa. Anteriorly, it is bounded by posterior border of laser wings of sphenoid bone, anterior clinoid processes and chiasmatic sulcus of sphenoid bone. Posteriorly, it is bounded by superior border of petrous part of temporal bone and dorsum sella of the sphenoid bone. Laterally, the squamous part of the temporal bone, the greater wing of the sphenoid bone and the parietal bones are present. And floor is formed by the greater wing of the sphenoid bone and squamous and petrous part of the temporal bone laterally, and medially it is formed by the sella turcica of the body of the sphenoid bone. This is the boundary of middle cranial fossa. In this bone, this is posterior margin of laser wing of sphenoid bone. This is anterior clinoid process and this is sulcus chiasmaticus which form the anterior boundary, and the posterior boundary, this is the superior border of the petrous part of the temporal bone, and this is the dorsum sella of the sphenoid bone. Laterally formed by the greater wing of the sphenoid bone and the squamous and petrous part of the temporal bone. In the floor, it is formed centrally by the sella turcica and laterally by the greater wing of the sphenoid bone. Now, contents of the middle cranial fossa. There are presence of pituitary gland, temporal lobe of the cerebral hemisphere with meninges, cavernous sinus and structures passing through the foramen. Now, we have to know what are the foramens present in this cranial fossa. First of all, this is optic canal on each side which passes optic nerve and ophthalmic artery. Then superior orbital fissure. This is superior orbital fissure. Which passes oculomotor nerve, trochlear nerve, ophthalmic division of trigeminal nerve, abducens nerve and ophthalmic vein. This is foramen rotundum which passes maxillary nerve, that is the branch of the trigeminal nerve, and foramen ovale. This is foramen ovale which passes mandibular division of trigeminal nerve, accessory middle meningeal artery and laser petrosal nerve. This is foramen spinosum. Which passes middle meningeal artery and its associated veins. Now, foramen lacerum. This is foramen lacerum which passes greater petrosal nerve, meningeal branches of ascending pharyngeal artery and emissary veins from the cavernous sinus. And last one is carotid canal which passes internal carotid artery and internal carotid nerve plexus. Here is carotid canal. In this figure, we can see this is optic canal, this is superior orbital fissure, this is foramen rotundum, this is foramen ovale, foramen spinosum, foramen lacerum, and here is carotid canal. Now boundaries of the posterior cranial fossa. Anteriorly, it is bounded by the superior border of the petrous part of the temporal bone and dorsum sella of the sphenoid bone. Posteriorly, it is bounded by internal surface of the squamous part of the occipital bone and floor is formed by the basilar, squamous and condylar part of occipital bone and mastoid part of the temporal bone laterally and foramen magnum present centrally. This is the boundary of the posterior cranial fossa. Anteriorly bounded by the superior border of the petrous part of the temporal bone and dorsum cell of the sphenoid bone. Posteriorly by the inner surface of the occipital bone and on the floor laterally presence of condylar part, basilar part and squamous part of the occipital bone and centrally presence of foramen magnum. Now contents of posterior cranial fossa. There are presence of brain stem that is formed by the midbrain, pons and medulla oblongata, the cerebellum and occipital lobe of the cerebral hemisphere. Now foramens in the posterior cranial fossa. Internal acoustic meatus. This is internal acoustic meatus which passes facial nerve, vestibulocochlear nerve and labyrinthine vessels. Then hypoglossal canal. This is hypoglossal canal which passes hypoglossal nerve and meningeal branch of the ascending pharyngeal artery. Then mastoid foramen. Here is mastoid foramen. Mastoid foramen which passes an emissary vein from the sigmoid sinus. Now jugular foramen. This is jugular foramen. It is divided into three parts. Anterior part passes inferior petrosal nerve, intermediate part passes glossopharyngeal nerve, vagus nerve and accessory nerve, and posterior part passes the sigmoid sinus. And foramen magnum. It is also subdivided into two parts. Through the anterior part, it passes apical ligament of dens and membrana tectoria, and through the posterior part, it passes lower part of medulla oblongata with its meninges, one anterior and two posterior spinal arteries, tonsil of cerebellum, and veins joining venous plexus of medulla oblongata with vertebral plexus of veins. These are the foramens of posterior cranial fossa. This is internal acoustic meatus. This is jugular foramen. This is hypoglossal canal and this is foramen magnum. Now there are some clinical anatomy such as fracture of the anterior cranial fossa may causes black eye, and fracture of the middle cranial fossa causes bleeding and discharge of CSF through ear, bleeding and discharge of CSF through nose or mouth, and damage of 7th and 8th cranial nerves due to fracture of internal acoustic meatus. In this figure we can see this is black eye which formed due to the injury in the anterior cranial fossa. So that's all for today. Thank you.